The human liver is a remarkable organ, weighing about 3 pounds and performing over 500 vital functions. It's the body's detox powerhouse, filtering out toxins and waste from our blood. Did you know it also plays a crucial role in digestion? The liver produces bile, which helps break down fats and absorb nutrients. This organ is a metabolic hub, regulating blood sugar levels and storing vitamins and minerals. It even has the unique ability to regenerate itself. If you lose up to 75% of your liver, it can grow back to its full size. However, it's not invincible. Excessive alcohol, poor diet, and certain diseases can lead to liver damage. So, taking care of this vital organ is essential for overall health. The liver truly is a silent hero in our bodies, tirelessly working behind the scenes to keep us functioning at our best. The liver is a vital organ located in the upper right side of the abdominal cavity. It plays a crucial role in maintaining the body's overall health by performing various functions, including detoxification, metabolism, and production of essential proteins. The liver is located below the diaphragm and above the stomach, small intestine, and right kidney. It is a triangular-shaped organ weighing approximately 1.5 kiloi, 3.3 lbs in adults. The liver performs the following functions. Detoxification removes toxins such as alcohol, drugs, and environmental pollutants from the bloodstream. Metabolism converts carbohydrates, proteins, and fats into energy. Production of bile produces bile, which aids in fat digestion and absorption. Production of proteins produces essential proteins, such as clotting factors and lipoproteins. Storage of glycogen stores glycogen, a complex carbohydrate that serves as an energy reserve. Regulation of hormones regulates hormone levels, including insulin and thyroid hormones. The liver contains two main types of cells. Hepatocytes perform the liver's metabolic functions, such as detoxification and production of bile. Kupffer cells are part of the immune system and help remove bacteria, dead cells, and other debris from the bloodstream. The liver receives blood from two main sources. The hepatic artery supplies oxygenated blood from the heart. The hepatic portal vein supplies nutrient-rich blood from the digestive organs. The liver is susceptible to various diseases and disorders, including hepatitis, inflammation of the liver, often caused by viral infections. Cirrhosis, scarring of the liver, often caused by chronic liver disease. Liver cancer, malignant tumors that develop in the liver. Fatty liver disease, accumulation of excess fat in liver cells. The liver is a powerhouse in our bodies, performing over 500 vital functions. It's like a master chemist, processing nutrients from the food we eat and converting them into energy. Imagine it as a detox center, filtering out toxins and waste products from our bloodstream. It also plays a crucial role in digestion by producing bile, which helps break down fats. Did you know it stores essential vitamins and minerals acting as a reserve for when our body needs a boost. Plus, it regulates blood sugar levels, ensuring we have a steady energy supply throughout the day. The liver even helps in producing proteins that are vital for blood clotting. It's fascinating how this one organ manages so many tasks, all while being resilient enough to regenerate itself. Truly, the liver is an unsung hero in our health. The liver plays a vital role in maintaining the body's overall health. Some of the key functions of the liver include detoxification, where it removes toxins such as alcohol, drugs, and environmental pollutants from the bloodstream. Metabolism, converting carbohydrates, proteins, and fats into energy. Production of bile, which aids in fat digestion and absorption. Production of proteins, such as clotting factors and lipoproteins. Storage of glycogen, a complex carbohydrate that serves as an energy reserve. Regulation of hormones, including insulin and thyroid hormones. Removal of waste products, such as bilirubin, from the bloodstream. And immune system function, by removing pathogens and other foreign substances from the bloodstream. Overall, the liver plays a critical role in maintaining the body's homeostasis and overall health. The liver is a remarkable organ, often referred to as the body's powerhouse. It's the largest internal organ, weighing about 3 pounds, and it plays a crucial role in metabolism, detoxification, and digestion. Structurally, the liver is divided into 2 main lobes, each made up of thousands of tiny functional units called lobules. These lobules contain hepatocytes, the liver cells responsible for processing nutrients and filtering toxins from the blood. What's fascinating is the liver's dual blood supply. It receives oxygen-rich blood from the hepatic artery and nutrient-rich blood from the portal vein, which carries blood from the digestive organs. This unique setup allows the liver to efficiently manage and distribute nutrients throughout the body. Additionally, the liver produces bile, essential for fat digestion, and stores vitamins and minerals, acting as a reservoir for the body. Its regenerative ability is astonishing. Even if up to 75% of the liver is removed, it can grow back to its full size. Truly, the liver is not just a vital organ, but a remarkable example of the body's resilience and efficiency. The liver is a complex organ with a unique structure that allows it to perform its various functions. The liver is divided into 4 lobes: right, left, caudate, and quadrate. The liver has a smooth, shiny surface covered by a thin layer of tissue called the visceral peritoneum. The liver is composed of hepatocytes, which are the main functional cells of the liver. Hepatocytes perform various functions, including detoxification, metabolism, and protein synthesis. Hepatocytes are arranged in plates, which are 1 cell thick. These plates are separated by sinusoids, which are small blood vessels. Sinusoids are small blood vessels that separate the liver plates. They allow for the exchange of nutrients, oxygen, and waste products between the hepatocytes and the bloodstream. Kupffer cells are specialized macrophages that line the sinusoids. They help remove bacteria, dead cells, and other debris from the bloodstream. Bile canaliculi are small channels that connect the hepatocytes to the bile ducts. They allow for the transport of bile from the hepatocytes to the bile ducts. The hepatic artery supplies oxygenated blood to the liver. The hepatic portal vein supplies nutrient-rich blood from the digestive organs to the liver. The hepatic veins drain blood from the liver into the inferior vena cava. The intrahepatic bile ducts collect bile from the hepatocytes and transport it to the extrahepatic bile ducts. The extrahepatic bile ducts transport bile from the liver to the gallbladder and small intestine. The liver is a powerhouse, processing everything we consume, but it's also vulnerable to a range of diseases. Take hepatitis, for instance. This inflammation can be viral, autoimmune, or even alcohol-related, leading to serious complications if left untreated. Then there's fatty liver disease, where excess fat builds up, often linked to obesity and diabetes. It can progress to cirrhosis, where the liver becomes scarred and loses function. And let's not forget liver cancer, often a silent killer, emerging from chronic liver conditions. Protecting our liver means maintaining a balanced diet, limiting alcohol, and staying active. Remember, a healthy liver is crucial for overall well-being. Here are some common diseases and disorders that affect the liver. Hepatitis A is a viral infection that causes inflammation of the liver. Hepatitis B is a viral infection that causes inflammation of the liver and can lead to chronic liver disease. Hepatitis C is a viral infection that causes inflammation of the liver and can lead to chronic liver disease. Hepatitis D is a viral infection that causes inflammation of the liver and only occurs in people who are already infected with hepatitis B. Hepatitis E is a viral infection that causes inflammation of the liver and is typically spread through contaminated food and water. Cirrhosis is scarring of the liver that can lead to liver failure. Fatty liver disease is a condition in which excess fat builds up in the liver. Alcoholic liver disease is a condition in which the liver is damaged due to excessive alcohol consumption. Non-alcoholic steatohepatitis, or NASH, is a condition in which the liver becomes inflamed due to a buildup of fat. Primary biliary cholangitis, or PBC, is a condition in which the bile ducts in the liver become damaged. Primary sclerosing cholangitis, or PSC, is a condition in which the bile ducts in the liver become narrowed and scarred. Hemochromatosis is a genetic disorder in which the body absorbs too much iron, leading to liver damage. Wilson's disease is a genetic disorder in which the body accumulates too much copper, leading to liver damage. Hepatocellular carcinoma, or HCC, is the most common type of liver cancer. Cholangiocarcinoma is a type of cancer that arises from the bile ducts. Hepatoblastoma is a rare type of liver cancer that typically affects children. Gilbert's syndrome is a genetic disorder that affects the liver's ability to process bilirubin. Liver cysts are fluid-filled sacs that can form in the liver. A liver abscess is a pocket of pus that can form in the liver. Hepatitis A is a viral infection that primarily affects the liver, and it's often spread through contaminated food and water. Imagine biting into a delicious meal, only to find out it was tainted. Symptoms can include fatigue, nausea, and jaundice, which is that yellowing of the skin. Thankfully, it's usually a short-term illness, but it can be serious for some. The good news? There's a vaccine. Getting vaccinated is the best way to protect yourself and your loved ones. Good hygiene practices, like washing your hands thoroughly, can also make a huge difference. So, let's keep our plates clean and our health in check. Hepatitis A is a highly contagious liver infection caused by the hepatitis A virus, HAV. It is a self-limiting disease, meaning it will resolve on its own with supportive care. Hepatitis A is primarily spread through fecal-oral contact, consuming contaminated food, water, or ice, person-to-person contact, close contact with an infected person, such as through touching, sharing food or drinks, or having sex, and contaminated food and water, consuming food or water contaminated with the virus. Symptoms of hepatitis A can appear 15 to 50 days after exposure and may include fatigue, loss of appetite, nausea and vomiting, abdominal pain, dark urine, pale or clay-colored stools, and yellowing of the skin and eyes, jaundice. In rare cases, hepatitis A can lead to liver failure, pancreatitis, kidney damage, and blood disorders. Diagnosis is typically made through blood tests to detect the presence of HAV antibodies or antigens, and liver function tests to assess liver damage. There is no specific treatment for hepatitis A. Supportive care may include rest, hydration, nutrition, and medications to manage symptoms. Prevention is key. Here are some ways to reduce your risk of contracting hepatitis A. Get vaccinated. The hepatitis A vaccine is highly effective in preventing infection. Practice good hygiene. Wash your hands frequently, especially after using the bathroom or before handling food. Avoid contaminated food and water. Avoid consuming food or water that may be contaminated with the virus. And avoid close contact with infected individuals. Avoid close contact with anyone who has hepatitis A. Hepatitis B is a viral infection that attacks the liver, and it's more common than you might think. In fact, about 1 in 20 people worldwide are living with it. The virus spreads through contact with infected bodily fluids, which means sharing needles or unprotected sex can put you at risk. What's alarming is that many people don't show symptoms until serious damage is done. Chronic hepatitis B can lead to liver cirrhosis or even liver cancer. But here's the good news. There's a vaccine that can prevent it, and antiviral medications can help manage the infection if you're already affected. Regular screenings are crucial, especially if you're in a high-risk group. So, let's spread awareness, not the virus, and take charge of our liver health. Hepatitis B is a viral infection that attacks the liver and can cause both acute and chronic disease. Hepatitis B is transmitted through blood-to-blood contact, sharing needles, syringes, or other equipment for injecting drugs, sexual contact, engaging in unprotected sex with an infected partner, mother-to-child transmission. A mother can pass the virus to her baby during childbirth, and occupational exposure. Healthcare workers and others who come into contact with infected blood or bodily fluids. Symptoms of hepatitis B can appear 45 to 180 days after exposure and may include fatigue, loss of appetite, nausea and vomiting, abdominal pain, dark urine, pale or clay-colored stools, and yellowing of the skin and eyes. Chronic hepatitis B can lead to liver cirrhosis, scarring of the liver that can lead to liver failure, liver cancer. Hepatitis B is a major risk factor for liver cancer. And kidney disease. Hepatitis B can increase the risk of kidney disease. Diagnosis is typically made through blood tests to detect the presence of hepatitis B surface antigen or antibodies, and liver function tests to assess liver damage. Treatment for hepatitis B depends on the stage of the disease. Acute hepatitis B treatment focuses on managing symptoms and supporting the body's immune response. Chronic hepatitis B treatment may involve antiviral medications to suppress the virus and slow disease progression. Prevention is key. Here are some ways to reduce your risk of contracting hepatitis B. Get vaccinated. The hepatitis B vaccine is highly effective in preventing infection. Practice safe sex. Use condoms and other barrier methods to reduce the risk of transmission. Avoid sharing needles. Do not share needles or other equipment for injecting drugs. And avoid occupational exposure. Follow proper protocols for handling blood and bodily fluids in the workplace. Hepatitis C is a viral infection that primarily affects the liver, and it's more common than you might think. It's often called a silent disease because many people don't show symptoms until serious damage has occurred. The virus spreads through blood, so sharing needles or even certain medical procedures can put you at risk. What's alarming is that about 70% of those infected develop chronic hepatitis C, which can lead to cirrhosis or liver cancer over time. But here's the good news. There are effective treatments available today that can cure the infection in most cases. Regular testing is crucial, especially if you've been at risk. So if you think you might be at risk, don't wait. Get tested, stay informed, and take control of your health. Remember, knowledge is power, and early intervention can make all the difference. Hepatitis C is a viral infection that attacks the liver and can cause both acute and chronic disease. Hepatitis C is transmitted through blood-to-blood contact, sharing needles, syringes, or other equipment for injecting drugs, blood transfusions from an infected donor, organ transplants from an infected donor, mother-to-child transmission during childbirth, and occupational exposure for healthcare workers and others who come into contact with infected blood or bodily fluids. Symptoms of hepatitis C can appear 150 days after exposure and may include fatigue, loss of appetite, nausea and vomiting, abdominal pain, dark urine, pale or clay-colored stools, and yellowing of the skin and eyes. Chronic hepatitis C can lead to liver cirrhosis, liver cancer, and kidney disease. Diagnosis is typically made through blood tests to detect the presence of hepatitis C antibodies or antigens, liver function tests to assess liver damage, and genetic testing to determine the genotype of the virus. Treatment for hepatitis C depends on the genotype of the virus and the stage of the disease. Acute hepatitis C treatment focuses on managing symptoms and supporting the body's immune response, while chronic hepatitis C treatment may involve antiviral medications to suppress the virus and slow disease progression. Prevention is key. Here are some ways to reduce your risk of contracting hepatitis C. Avoid sharing needles. Practice safe sex using condoms and other barrier methods. Avoid occupational exposure by following proper protocols for handling blood and bodily fluids in the workplace, and get tested if you are at risk of infection.